While there is no known cure for mental illness, there are a number of varying and proven effective treatments available. After a diagnosis is made, patients work with their therapist or other healthcare professionals to determine options for the best course of treatment.
If you do have a diagnosis and the professional says, it looks like you do have anxiety or it looks like you do have depression, they can talk to you and collaborate on a number of treatment options.
There's not oftentimes a quick fix to a mental health or a substance use issue. It takes time, and there's ups and downs. 3 steps forward and 2 steps back has never applied more than it does to mental health treatment and substance use treatment.
In general, a good way to begin for someone in school or in college is really to begin with what we call psychotherapy or talk therapy.
Starting with talk therapy, I think that's what most people think of when they feel like, okay, I've been depressed or anxious, I'm going to go talk with somebody. And what's important to know is that counselors and therapists, they're really good listeners, but they're highly trained at understanding what it can take to help people move through different issues that might come up.
And talk therapy actually has neurochemical benefits. So, the mild to moderate episodes of depression generally will respond to psychotherapy. So having good psychotherapy as the first step, I would say, would be the way to go.
There are a variety of talk therapies available, each with its own focus.
The problem-focused cognitive behavior therapy can be very effective. So, this is not therapy where, you're talking about growing up or anything. It's very problem-focused. You understand the triggers, you understand your thinking and your reaction around the triggers, you understand and you develop strategies to manage those.
Psychodynamic theory is going back to how you were raised and how your past affects your present. I use something called memory reconsolidation therapy to work with trauma. So it's more than talk therapy. It's a lot of visualization and relaxation to help you process painful past learning.
The psychotherapy in anxiety disorders can help you gain control of the anxiety through behavioral techniques. It's very effective and really needs to be the first step in most cases.
Often, doctors will add proven medications to help patients.
We have our talk therapy, and that's really helpful for a lot of different types of diagnoses. Medications can also be very helpful, but a lot of it depends on what the diagnosis is. There's where a lot of these types of things come into play to try to rebalance, if you will, the ratio of some of these chemicals in the brain so that then we don't maybe feel depressed or don't feel too anxious when things happen. And that's what medications oftentimes will kind of work on those types of factors.
The therapist will do an assessment and evaluate the severity, and typically they would do focus sessions, whether typically it's 12 to 16 sessions to see how things go. And if the response rate is not there, if the individual feels that their goals have not been met, then at that point they can start to look at a medication intervention.
There are medications out there that are very effective, and we know that. And I'm talking as a non-physician, so I'm not a physician. But when we look at the research, we know that medications are effective. Medications for anxiety are effective.
Maybe somebody can't get out of bed. They are very depressed. They're not taking care of themselves. They're not motivated, and it's impacted. They're not making it to work. It's not that talk therapy won't be helpful, but it's almost like we have to first get them up to a level where talk therapy can kind of take hold.
Beyond talk therapy and medications, there are other ways for patients to treat mental illness.
Things like meditation or mindfulness or yoga.
It might include support groups. It might include different things you can do for yourself in terms of physical exercise, changing your diet, some simple things that may benefit you, and in conjunction, there may be a menu of 2 or 3 different things that works best for that person.
Oftentimes, there's a combination of these treatments that people sort of engage in. Oftentimes, that's a better approach than just 1 or 2.
It is not uncommon for patients to have difficulties with treatments due to the stigma associated with mental illness.
Stigma has always been a challenge in the mental health field, but I will say, even in the time I've been in the field, I think we made tremendous strides toward normalizing the fact that a lot of us do need more support and do need help.
I think that we're good about talking about mental health. Now, crossing the bridge into treatment is still where there's a little bit more of a gap, and we have work to do on that.
Stigma does still exist. Some people are very hesitant to acknowledge that or to get help. And so it's just about letting them know that it doesn't make you a bad person. In fact, in many ways, it makes you a stronger person to be able to speak up, to say, yes, something is going on that's not right. I do need to see a therapist, or I do need to talk to somebody to see what I can do to improve this.
College of DuPage offers free counseling available through counseling, advising, and transfer services located in the Student Services Center, SSC 3200, or by calling 630-942-2259.
COD offers personal counseling services to students free of charge. Just by being a student here, students have this resource available to them.
Give us a call, let us know what's going on and what you need, and then we'll help you out.
The service we offer to students is personal counseling, and so we differentiate that from therapy in that we do not diagnose and that we're not a clinical setting.
The college, focuses on more short-term counseling, and so we're really looking at helping students through life transition issues, things that are really getting in the way of students being able to be successful academically. And so usually we will see students where it's a short-term issue, something that can be resolved in 3 to 4 sessions, and then the student is able to proceed and be successful in college.
We'll figure out what you need to do. We'll connect you with a counselor who will have a conversation with you about what's going on with you. And from there, we're going to figure out how to best help you.
If you're having problems, remember, help is available. And most often, making that first call is the hardest thing to do.
It's okay to not be okay. In fact, it's very strong of you to ask for help.
So many people are going through the same thing. And I think it's so much more important to be able to talk about how you're feeling, talk about how you're not feeling okay, because that's the first step to getting better.
If you are thinking of suicide or hurting yourself, dial 988 immediately. The Suicide and Crisis Helpline provides free, confidential support. Help is waiting 24 hours a day, every day.